now take mastectomy and show our viewers a graphic of what it entails, and walk us through this, doctor.
Sure. So as opposed to lumpectomy, mastectomy involves removing the entire breast. And so that can be done with immediate reconstruction, and it's usually done in coordination with a plastic surgeon to do the reconstruction at the same time. Now, even the best reconstruction will never look exactly like the native breast that the patient had beforehand. It won't look the same, it won't feel the same. The sensory changes that occur during surgery is those small little sensory nerve endings that lead up to the skin get cut, and so a lot of times after surgery, patients will not have the same sensation to the skin that they had prior to surgery, and so that's something they also need to be aware of. It obviously takes longer than a lumpectomy, and it involves an overnight stay in the hospital, and patients have drains in after surgery. They're usually able to go home the next day after surgery, but I usually advise patients that it's going to take about a month to really get back to work and get back to normal after this type of surgery. It's a much bigger ordeal. There are different types of reconstruction, and depending on the type of reconstruction that the patient has, the surgery can last anywhere from like 3 to 8 hours, so a much longer surgery done under general anesthesia. Now, if the patient desires mastectomy or actually needs a mastectomy, it can be very safely done, but we try to do it only when it's absolutely necessary. There are different types of mastectomy to consider as well.
And is it, would you say mastectomy is more common than lumpectomy, or is it the other way around?
It really depends on the geographical area that you look at in the United States.
Really?
So yes, because with lumpectomy, we always recommend postoperative radiation. And not every patient is going to be near somewhere where they can receive radiation. In addition, with mastectomy, we usually recommend doing a reconstruction, but not every patient is going to be at a major center that offers reconstructive surgery. So it varies, depending on where you look in the United States, whether lumpectomy or mastectomy is more popular.